Tamoxifen by Richard Logan. Since its approval in 1998, tamoxifen has been used to treat millions of women and men diagnosed with hormone receptor positive breast cancer. A large proportion of breast cancers express the estrogen receptor, and the progression is dependent on intact estrogen signaling. Treatment of ER-positive breast cancer usually includes a therapy that is designed to block estrogen signaling. This is where tamoxifen comes in. To describe in a cellular level, I made a little video for y'all on the next slide.
This is your regular generic cell. It has a few organelles and a nucleus where DNA is kept. As you can observe, the bigger than usual estrogen receptors. Now these are where estrogen comes into the cell and binds. You see right here, estrogen binds to each receptor and helps the cell with normal function. This is in a healthy cell. Now in the cancerous cells, you have a bunch of estrogen. A bunch of it is going to flow into the cell, and the cell is just going to keep on accepting it, making the cell grow and divide rapidly, making the tumor grow bigger and bigger. Now the role of tamoxifen is, let's just erase this real quick, is to come in here and bind to these sites right here. There's tamoxifen. They're going to bind to these sites where the estrogen will normally come. It acts as a cap on the receptors where the estrogen normally bind. Now when estrogen tries to come in, into the cell, it's going to get stopped by the tamoxifen and bounce off. And therefore, the cell cannot grow and divide, thus the cancer is stopped.
So as I said in the last video, tamoxifen competitively inhibits the binding estradiol to estrogen receptors, thereby preventing the receptor from binding to the estrogen response element on DNA. Tamoxifen is a prodrug with relatively low affinity for the estrogen receptor. It undergoes extensive first-pass oxidative metabolism into more active metabolites by the cytochrome P450 pathway. In addition, tamoxifen upregulates the production of transforming growth factor B, a factor that inhibits tumor cell growth, and downregulates insulin-like growth factor, a factor that stimulates breast cancer cell growth. Tamoxifen has both estrogenic and anti-estrogenic actions depending on the target tissue. It is strongly anti-estrogenic on mammary epithelium, hence its use in both the prevention and treatment of breast cancer. It is pro-estrogenic on uterine epithelium, resulting in the current controversy regarding its safety in cancer prevention, which I'll explain in the next slide. This is why we define tamoxifen as a selective estrogen receptor modulator, meaning its selection either blocks or activates estrogen's actions on specific cells. For example, while tamoxifen blocks estrogen's action on breast cells, it activates estrogen's action in bone and liver cells, so it helps stop bone loss after menopause and lower cholesterol levels. So as I previously stated in the last slide, it is tamoxifen's pro-estrogenic property on uterine epithelium that have resulted in the current controversy regarding its safety in cancer prevention. This is due to its association in the increased incidence of found endometrial lesions, including hyperplasia, carcinomas, and sarcoma in women undergoing chronic treatment with tamoxifen. With time, the risk of endometrial cancer increases drastically, which is a reason tamoxifen is typically recommended for 5 years. But not all of the pro-estrogenic effects are harmful. Tamoxifen pro-estrogenic action is also evident in bone matter, where it mimics the effects of estrogen and provides the signals required for bone maintenance, thereby inhibiting osteoclasts and reducing the risk of osteoporosis in menopausal women in particular. Tamoxifen's selective estrogen activation effects can cause some serious side effects, as I listed many here, but I highlight the two main ones that women complain of, which are hot flashes and nausea. So the question I have while tamoxifen is commonly known as an anti-estrogen, this is not an accurate description of its clinical activity. Why is that? References.